Nutrients for type 2 diabetes. There are about 20 different nutrients that getting more of those from our diet reduces the risk of type 2 diabetes or improves insulin sensitivity and blood sugar regulation. So if you want all 20, that is available in my Patreon, the Nutrients for Type 2 Diabetes ebook. But let's like hone in on three of what I think are probably the most important. Vitamin D impacts risk for type 2 diabetes in a few different ways. It directly impacts how much insulin pancreatic beta cells secrete in response to rising blood sugar levels, and affects cell survival, so how many of those cells are around to secrete insulin in the first place. And low vitamin D levels decrease the number of insulin receptors in our cells. So there's a huge body of scientific literature showing that people with low vitamin D levels have increased risk for type 2 diabetes. And if you have prediabetes, every 4 nanograms per milliliter increase in vitamin D, just going from like 30 to 34 nanograms per milliliter on your vitamin D blood test, reduces the risk of progressing to full type 2 diabetes by 25%. Next is chromium, which is a cofactor for a peptide called chromodulin, basically needed for chromodulin to work. And chromodulin is cool because it enhances the effects of insulin after it binds to its receptor inside the cell. So when insulin binds to a receptor on the cell, that causes a cascade of chemical reactions that ultimately results in the glucose transporter moving from inside the cell into the cell membrane, which can then let glucose cross through the cell membrane and into the cell. And chromium via chromodulin is important for that signaling cascade. And while we definitely need more large clinical trials, there are a variety of smaller ones that show that increasing chromium intake not only improves insulin sensitivity and the glucose response, lowering things like hemoglobin A1C, but also can improve serum lipid profiles in type 2 diabetics. And third, magnesium, which is an interesting one because this affects both people with type 1 and type 2 diabetes, who tend to have low serum levels of magnesium, likely due to the loss of magnesium as part of an abnormal glucose response. But what's interesting is that magnesium depletion seems to worsen insulin resistance and adversely affect glucose control. And people who get more magnesium from their diets have a lower chance of developing type 2 diabetes. Actually, for every 100 milligrams more magnesium per day, which is a third to a quarter of the daily value, risk of developing type 2 diabetes decreases by 15%. Now, before you get tempted to just run out and buy 3 bottles of supplements, remember this is just 3 out of the 20 or so nutrients that are important for reducing our risk of type 2 diabetes. And that's why Nutrivore is such a powerful approach, because the goal is to get all of the nutrients our bodies need from the foods we eat. The value of a food-based approach is that it's easier, cheaper, and more effective to get the full range of nutrients that are important for supporting long-term health, and in this case, reducing risk of type 2 diabetes.